My name is Amir Mehrkar. I'm the CCO for Orion Health and the co-founder of INTEROPen and the InteropSummit. The term interoperability for me means information sharing, and another way to describe it is the Robin Hood principle of information sharing, where you take from the information rich and you give to the information poor, so you can provide better care at the coalface for your clinicians and also the patients. I think the benefits to an organisation come to its people as well as to the financial aspects of an organisation. In terms of the people, obviously as a clinician, I'm a GP, I'm very passionate about my colleagues getting the most benefit from data flowing. It will make the clinicians' lives much easier. We want to deliver faster care, we want to deliver safer care, and the third one is we want to be more precise and tailor that care to the actual individual. The organisation becomes more efficient and has massive cost savings, because if you provide faster care, you can actually improve the efficiency of your organisation. Maybe you'll see more patients, maybe you'll do different things and provide new services. At the same time, safer care reduces adverse events. Adverse events cost money. Also, patients stay in the system longer, which costs the organisation more. Interoperability has become such an important issue in healthcare of recent times because of the huge proliferation of digital. We've got digital devices, we've got more IT systems, especially in hospitals, that are becoming more digitally driven. And so what's happened is there are a lot of systems that are appearing that need to talk to each other because people are realising the benefits of sharing information across their different sectors. Increasingly in modern times, there's been a big gap in what the NHS has in terms of funding because the patients now have much more complex illnesses. In order to look after them, they're going between different sectors, and those sectors, hospital, community, GP, have to now start working together to realise these benefits. And in order to do that, data needs to move. And so there's a movement now to accountable care organisations to deliver value-based care. So their reimbursement mechanisms are going to move from activity into outcomes. And to reimburse on outcomes, you need to share data. Now, INTEROPen is a collaborative community of vendors, organisations, individuals interested in creating actually national interoperability standards, and now has over 80 members, of which many of them are vendor organisations, but we now have hospital trusts, we also have STP members as well, and they've all signed up to a common set of values, that is openness, transparency, in order to create national interoperability standards. And so the benefit is that vendors who use INTEROPen standards and providers who are aware of it can then buy from vendors who are actually open and using interfaces that can share data. But one thing we recognised was that despite the fact there's a lot of information out there and a lot of knowledge about interoperability, technical experts, clinical experts, actually not everyone has the same common understanding, and education is a really important feature. So my co-founder colleagues and myself, they are Dr. Wai-Kyung Wong and Dr. Kian Hughes, founded the InteropSummit, which is an educational event to try and bring everybody to a common level of understanding of interoperability. Now's the right time for senior board members to be fighting that data saves lives flag, because if they truly believe in the movement of data providing safer, faster and more precise care, they're also going to benefit because of the massive efficiency savings that can bring. What I would advise them to do is speak to their IT departments and say, are our vendors using open standards? Are our vendors part of INTEROPen? Do they believe in the values of openness, transparency and using national open standards? Now's the time for senior board members to actually get right involved in that data saves lives agenda.